17 years. We'll welcome them back.
I wish the rain were so predictable.
Yeah, no kidding. Okay, so I have 1:15 straight up, so we'll go ahead and get going. Welcome everybody to our weekly gathering on all things regarding the COVID pandemic with the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for Indiana University. We will begin with opening comments before questions from media. We'll begin with Mayor John Hamilton.
Thanks, and good to be with you all. Thank you, Chuck. As always, just a quick factual updates on the city. We did report again one case of positive diagnosis among our employees this week. That's one case each of the last 2 weeks after 3 weeks of no cases. We also have now had 514 of our employees apply for the $100 reimbursement wellness benefit. And I don't always mention, but the City of Bloomington Utility continues to monitor background levels of the viral RNA in the wastewater streams. Those continue at the low levels that they've consistently seen over the last several months for background levels. I will note we have a survey out to our employees about what might increase vaccination levels, and we'll report on that in the days, weeks ahead, probably. Continuing to watch the overall general positive direction of the state in terms of cases and deaths and hospitalizations. And similarly local, though we may hear a little bit about hospitalizations today, I know. But again, basically good direction. We know the state is still on the low end of vaccinations among our fellow states around the country. We're still in the lower third or quarter, depending on how you measure. So that does cause us some concern. I will say, after our meeting last Friday and what happened with the weather, given the range of pandemic, cicadas, flood, hail, I guess I'm glad I'm in this community, knowing whatever comes next. I'm not sure what is next. It's been quite a run, an extraordinary week too, but appreciate the way everybody pulls together here in this community to handle this. We will hear today, I know, about some of maybe the routinization, the trying to move some of the testing and some of the vaccinations into more routine places, which is a good thing and sensible as it should be. Things like public meetings moving to hybrid setups in the next month. So we are starting to shift into continued change. I think even this meeting will talk about shifting to every 2 weeks in July as we move forward. The Rescue Plan Act, I know the city and county are both going to be looking at that going ahead too as we continue to invest in recovery. So we are not out of the woods, but maybe we can see the edge of the woods ahead. And I hope that's true. Again, we have to be humble, but we will need to keep vaccinating and need to keep protecting ourselves and keeping safe as we go. But let's hope the progress continues and surprises are reduced. And I'll be happy to answer questions. Back to you, Chuck.
Okay, let's next check in with Monroe County Health Department Administrator Penny Caudle.
Good afternoon, everybody. So just to start with our numbers and where we are, hopefully people check the dashboard, and I'm not going to give you anything too unusual. As the mayor said, things are kind of holding steady. Currently, our rolling average for daily cases is about 6. We do remain in a blue advisory, and our cases per 100,000 is kind of just hanging around that 27, 28 per 100,000 range. Our positivity rate is kind of jumping from just under 2% up to hovering just under 3%. This week's metric, we were at 28 per 100,000 with a 1.6% positivity rate, but our positivity rate for today, if you looked at the dashboard, is 2.5. We added 6 new cases, and 1 new death was reported this week. So we are not out of this pandemic yet, and we do continue to see variants throughout the state. There are over 106 cases of the Delta variant that have been identified. And keep in mind that when they talk about the variants being identified, it is not an exact number. That is a minimum number because they do not test every single sample. It is kind of a random sampling that they're doing. So we know that all the various variants are here. The way to reduce those is really through vaccination and not spreading the virus. So you can greatly reduce your chance of infection or still the chances of serious illness or hospitalization by being vaccinated. There are very few breakthrough cases, and those that do break through see even further low rates of hospitalization being needed. So there's lots of opportunity for vaccinations. And when you are fully vaccinated, there's little need for testing unless you are exposed and you develop symptoms. You don't need that routine testing that we saw so many people need this time last year. So there are changes coming as we do make all of these things a little bit more of our normal routine. But currently, there are lots of reasons to be vaccinated. A little bit is that reduction in the need for testing, no need for quarantine. You've heard me say that before. If you're exposed and you're fully vaccinated, you just need to monitor for symptoms. You don't need to quarantine. So good reasons to vaccinate. And I just, before I got on this call, was on a call, Ask the Experts, talking about vaccines and women and children. Very good panel of experts, and would encourage people to look at that. That was through the university. So lots of good information, trying to answer people's questions who may still be concerned or have questions about vaccinations. Visit ourshot.in.gov. There's a map. We talk about it almost every week. You can find all the different vaccination sites throughout the state. There are 17 places to get vaccinated in Monroe County right now, 18 if you include the state's mobile unit that is sitting in Harrodsburg right now. They have been there since Wednesday, 9 to 6. So you still have an opportunity yet today to go to Harrodsburg Community Center. If you didn't make an appointment, you can walk in and they will see you. So 18 options today, in this community. So IU Assembly Hall is an option, is open 3 days a week. We have Moderna Mondays at our public health clinic, which is our partnership with IU Health. We have a mobile clinic today at the Harrodsburg, as I mentioned, local pharmacies, and we continue to do homebound and plan other outreaches. Our nurses will be at Mother Hubbard's Cupboard on July 1st. They will be there from 12 to 2 and 4 to 6 doing vaccines. Rides are still available. You can call 211 if you need a ride. So we do encourage people to take these opportunities while there are so many of them. And we truly are trying to break down all the various barriers to getting to that vaccination. Our current vaccine numbers, we are at 54.7% are fully vaccinated, 53.8 have received a first dose. And so I want to ask you, can we make it to 55 by next Friday? Or could you even push it up to 60%, right? So I believe that we could definitely get to 55%. I would like to hope that we could push it up to 60% in the next week or 10 days. So I'm going to put that challenge there to you, and we'll see next week where we are. I did mention less need for testing when people are fully vaccinated. And as the mayor mentioned, mass testing sites and vaccination clinics, those are going to start being pulled back. And point of care will really be where you get your vaccine or you get testing. It will be more of the typical places. So take advantage of those extra opportunities that are out there right now. The Optum site did close last Friday, and we want to thank those individuals who worked that clinic for us, for the county, and thank them for that opportunity. I do want to take a moment. I'm going to try to share my screen. Hopefully, maybe not. Oh, yep. Hey, how about that? So if you want to find where you can go to get testing, this is the map on the state's dashboard, and you can see that right now we have 9 places in Monroe County that you can go and get tested. So take opportunity with that if you need to be tested for COVID-19. The Morton Street site is still open, and our partners, the city, the county, the hospital, the university, we've all partnered to provide this site for you since last fall, and are working to continue that through July. So we are kind of still in those stages of finalizing all of those plans, but that Morton Street site should be available to you for another month. But again, there are a variety of sites that are available, and we encourage you to check out these maps for whether you need vaccination or you need testing. Information, we will be providing more information like this. We'll be putting it together and sending that out as kind of a press release media information so that you have that handy as well. Just know that information does change, and your map that I'm showing you is the fastest way to get that information. And that is what I have for you today, Chuck. Thank you.
Okay, let's next go to the Monroe County Board of Commissioners and Julie Thomas.
Hi, everyone. Thank you again for being here every week with us. It's important that we keep this information going. As has been pointed out, this pandemic is not over, although we would love it to be. And the way we can help get it over is by getting vaccinated and talking to our friends and neighbors and helping them get the information they need so that they can also get vaccinated. Wearing my tie-dye shirt today to remind you to get a vaccine, but actually spent the morning with my colleagues on the Board of Commissioners at the food bank for Fresh Fridays, helping distribute food. And by the time I left there early, there was about 200 households that have been served already. So there's still a need in the community. If you want information on that, hhfoodbank.org. We were just notified yesterday, I believe, the CDC has extended the eviction moratorium through the end of July, which is great news. But at some point, we're going to be facing an issue. But just a reminder to all of our county residents that the Board of Commissioners and the County Council have provided funding to township trustees. And that Township Assistance Fund is available for anyone who needs emergency assistance with things like rent and utilities or other necessities. So if you do need assistance, every resident in Monroe County, whether you live in the city, town, or in the rural area, every resident lives in a township. Please contact your trustee as soon as possible. We are planning, once the governor order lapses, to go back to hybrid meetings. All of that information will be available on our county website. And just a quick reminder that if you would like to stay in touch with updates on health or weather emergencies or anything else, go to co.in.us and click on the resident notification system. It's a megaphone on the front page of our website, and sign up to receive texts or emails. You get to choose how you receive information. But with weather and COVID and everything else going on, it's a really great source of information for you. And with that, we'll take questions. Thanks.
Okay, let's next check in with IU Health and Brian Shockney.
Thank you, Kirk. Last week, I shared that we had a slight decrease in our inpatient cases in the South Central region. Unfortunately, this week, we've seen a comeback in numbers of our double digits of inpatients and those sick enough to be admitted in not only our hospitals here in the IU Health South Central region, but also in Monroe County. And so we continue to keep an eye on our volumes, but as you can see on the screen, a real bouncing around, which tells us that we are not out of the woods. And like the mayor's words, we must be very humble about how this affects our community. As Penny shared, we are excited to extend our partnership with the health department to keep the Morton Street COVID-19 testing site open another month. This has been a valuable partnership since the fall to really ensure that we could care for the volume of testing needed. And I just want to stress that if we get more people vaccinated, the need for testing, while it has dropped off dramatically, will go away. Because we will have people vaccinated and we will not need to do all the testing. Early in July, our Southern Indiana physicians, primary care, and pediatric offices will soon have COVID-19 testing available. And it's for those who experience symptoms, and you can make an appointment with your provider's office, just as you would if you had the flu or any other illness. Now, this is a big step in continuing to operationalize our response to COVID-19 for the long term. Our primary care and pediatric clinics, they will also have vaccines available and offer them for individuals who have appointments. So if you've not been vaccinated, you can and will be able to schedule an appointment with your provider, an IU Health provider, and you'll be able to get that vaccine. We will not be accepting walk-ins at our clinics for testing or vaccines. It will be a scheduled appointment because there are opportunities, as Penny said, many locations around our county that you can walk in, walk up and get your vaccine or get tested. Our outpatient pharmacy at IU Health Bloomington does take walk-ins and appointments every Monday from 10 a.m. to 2 p.m. for anyone interested. So you can go online to the State Department of Health website and you can schedule that appointment. And lastly, I want to thank everyone who has gotten their vaccine or shared vaccine information with others. There's some great information out there that's science-based and from experts. And we encourage you to keep getting that information from the experts and just letting others know that you got your vaccine. Just because you're in a setting with those who are not wearing masks doesn't mean everyone is vaccinated. So we would appreciate you just, maybe even wearing your mask into a social setting and taking it off and saying, I'm taking my mask off because I am vaccinated. And that says a big statement to many people in that location, that gathering, or that place. So thank you, and I'd be happy to take questions at the end.
Okay, let's next check in with Indiana University and Kirk White.
Hey, good afternoon. Some numbers, as I usually start out with. Last week, our mitigation testing numbers stayed steady, but remember they're pretty low now because of the high number of people vaccinated in the lower population of the campus. But we tested over 1,400 of our students, faculty, and staff last week, and only one positive of that whole group. So well under control there. That number, we hope will stay low. Certainly we'll have testing this fall for those who are have filed an exemption for religious or medical reasons. They will still be in the mitigation testing pool and as part of our student, faculty, and staff community in the fall. We're up to probably this weekend, we'll hit the 40,000 vaccine doses mark at our Assembly Hall site. We're very proud of that and look forward to at least continuing the mass vaccination site through July. And we're looking now at the numbers, and as Director Caudle mentioned, the number of places where vaccines are available in the community continues to increase. And so we're looking at whether we still need to have a mass site in the community, but we're planning to continue at least through the end of July. There's one more week of our incentives for our faculty and staff to submit their verification and documentation of their vaccine status. So our contest with those prizes will end next week, and the grand prizes will be announced. So that's gone very well, and our documentation and vaccine rates continue to increase, which gives us great hope for what we think will be a successful and back to normal fall activities on the campus. And I think everybody noticed that includes our athletic facilities. Are planning for full capacity at our stadiums and athletic events, which is just one more piece in what we expect to be a great fall semester, getting us back to normal. And as I may have mentioned last week, we are expecting a record freshman class this fall. I think people, as they looked at selecting a university, looked at the success that we had this past year in managing the pandemic, and have given us a vote of confidence in the fact that they do plan to come to the Bloomington campus and study this fall. And so we're looking forward to welcoming them as August approaches. And that's all for the university this week. Happy to take any questions.
Okay, thanks very much, Kirk. We will get into questions. This first one, I think, is probably best directed at Penny and Brian, at least to start with here. It's from Indiana Public Media. A few different questions they've got. We'll start with the first one. What are community leaders doing to plan and take precautions against the Delta variant? Penny, let's start with you there.
Well, the first thing is vaccinations. That we know that vaccines right now are still protective and offering effective prevention from all the variants. So offering vaccinations and encouraging that, trying to answer questions if people are still, wondering and not getting vaccinated because they have questions. So the big answer is vaccination. That is the biggest tool we have for that, and just education is second to that. Really is making sure people understand and they have the information so that they can make good choices.
And I would add to that, we continue to ensure that we wear masks in social settings or even business settings where we aren't sure if everyone is vaccinated, and still continuing to practice just good health hygiene, sanitizing and washing your hands and covering your mouth with your elbow when you cough, and those kind of things that I think, I know we will not look at flu season or cold season, and it is summer cold season. We're seeing those right now in the same way. And a mask is not, it is a socially acceptable thing. So wearing your mask in a situation where you aren't sure if everyone is vaccinated or not is a good thing to do if you're not, so you protect yourself and others as well.
Okay. Next one to Kirk, and I think you alluded to some of this already. What are IU's plans regarding the decision to allow fans back at Big Ten sporting events for the fall? And do they support this action with the Big Ten? I assume that means IU.
Yes, we're very excited about that. These high vaccination rates and the continuance of that lead us to believe that we'll be able to do have a successful athletic season. And this is, of course, our planning for all this is in conjunction with the state and local health department guidance as well. So yes, we're looking forward to a full house at certainly in Memorial Stadium and at our other venues in the fall.
And that, I think the athletic department announced that last Friday, maybe 100% for Memorial Stadium and other fall events here.
Yeah, I just might add, Chuck, that
yeah.
Speaking of football, our friends over at Assembly Hall and Memorial Stadium tell me that we're having a great amount of interest in the football season this year. Lots of new season ticket holders. I think there are lots of pent up demand and wanting to celebrate the great success we had last year. So it's going to be great that we can get back to tailgating and having great weekends at Memorial Stadium this fall.
Next question from Dave Askins, the B Square Beacon for Penny. Was the vaccination clinic set for last Saturday at Switchyard Park still held? And if not, are there plans to reschedule?
It was still held. The Friday night and Saturday morning were horrible. But Saturday late afternoon, it was very, very pretty. I went down to Switchyard to the Juneteenth event, and the sun was out and people were enjoying the area and having a great time. We did about 5 vaccinations, so we did not see a ton of new people vaccinated, but 5 is 5. And I am happy every time we get more people vaccinated. We did have a lot of people telling our nurses that they had already been vaccinated. And so we're always happy to hear that as well, but glad to be there and make it available to people if they are ready to and need it.
Next question from Dave Askins again for Kirk White. Are you able to hang a specific number on the percentage of students, faculty, and staff who has submitted verification for vaccination so far?
No, Dave, I don't have those numbers yet. I haven't seen them yet. Our IT folks are telling me that they're coming in at a steady pace, but not giving me any progress reports yet. Our recommendation is that students get this done at least by July the 1st, so that if they need a second dose, they can get that completed as well, and it gets to be in full effect by the time they would come to the campus. So that's our big push right now, and we're using all of our communications means to do that, sending emails, texts, social media, and other things. And that's why we culminate with our contest and sweepstakes to give away those awards for everybody who's gotten that verification submitted by the end of next week.
Okay. Next question from Dave actually is where I was going to go next, because I was going to do my traditional vamp. If you have other questions, not seeing any others, but to clarify the schedule, Mayor Hamilton alluded to. So next week we will have a news conference, and then we will go to every other week after that. I believe through August is the plan right now, and see where we are as we start to approach the school year. So we will have one next Friday. We'll not have one the following Friday after that. So anything else to add to that, Mayor Hamilton?
Well, I was just going to say, a lot of us been in and out of public sector stuff. I've never been involved in something that had 16 months of weekly press conferences. And this is since March of last year. This group has shared, you as reporters have shown up. It's been just an amazing run of trying to keep everybody informed, and we had no idea in March of 2020 that it would run this long. I think many of us thought it would not. And I really appreciate the attention that people have given, the opportunity for, the public to hear what's going on for us. We meet separate from this. We got to get our story together before we share it all. We meet weekly as well to share data and plan and respond. And it's just been really an exceptional, for my mind, unprecedented collaboration on this. Chuck, you've been a rock through all this, making all this happen. You didn't sign up for 16 months when you said yes, but we appreciate that. And I think shifting to every other week, we'll see if it works, or we need more or less or whatever. But I do think it's worth noting what an extraordinary commitment of time from all people involved. And we appreciate that. I appreciate it.
It's certainly, I have really enjoyed doing this, and I would second everybody showing up, Dave being maybe the most steadfast among them, for this every week, because it doesn't make any difference if we share information and nobody's there to share it with the public. So it is certainly appreciated, and we will assess where we are doing it every other week as we move along here. But that does make some sense given the summer schedules, but also where we are in the pandemic. But again, my appreciation to everybody here and the reporters for showing up. It does indeed make a difference, and it has made a difference in this pandemic.
Chuck, I'll second the mayor's comments and add something to that. I think what this has also done for us, you see this group of officials from various parts of our leadership in the community. This has also set us up well to respond to other emergencies, and we're very comfortable getting together now on Zoom, and I've never quite seen this level of good communication before, thankfully, we haven't needed it before, but now we have this past year, and it's made it a really good environment for us to build trust among ourselves, helping make decisions for the community, but also getting the message out in a coordinated way. And so I think we've learned some good things. And and I hate that terminology that someone uses, never waste a good pandemic. But we're not wasting it. We've learned some good things, and I think we'll take them forward.
Absolutely.
I would agree, and I appreciate you saying that. I think we have forged relationships during this pandemic among these various parts of the community that will serve us well in other aspects of leadership and governance. So I'm grateful for everybody.
I might add one more thing as we look to the holiday weekend next weekend, to remind everybody that we're going to have a very safe, COVID-friendly reverse July 4th parade on July the 3rd. And I just want to send my great thanks to the City of Bloomington's Parks and Recreation Department for organizing that. They called us at the university and asked to use our lots on the north side of the athletic complex. And of course, we're very happy to be able to do that. It again is another great partnership because the city takes the burden of organizing the parade, and all we have to do is make sure we've got the space available and providing some physical and security and police support and things like that. But I'd encourage everybody to attend on July the 3rd. We're not going to be able to do it downtown like we normally would, but you can drive through the parade parking lot and see the floats all assembled. So you'll drive through, the floats will be static in place, and it'll be safe because you'll be in your car and will be distanced. And the city's even planning to have some giveaway bags for the first few hundred people that arrive. So that's Saturday, I believe, on the 3rd from 10 to noon. I think that's right, Mayor.
I think that's right, Kirk. Thank you for giving us the space to do that. And let me just say, I think this may be your only chance to do a reverse July 4th parade in your life, we hope. So, get out there and see what it's like. We really appreciate the collaboration. By the way, I should name somebody we don't see is Andrew Krebs, who every week has live streamed this show, even when he's on vacation. And thank you, Andrew, to make it available on Facebook to a different channel too. I want to shout out to the staff of the mayor and Andrew in particular for that help with partner to you, Chuck.
Oh, yeah. And Andrew's been fantastic, and I really appreciate it. And Andrew and Yael Cassander, of course, have been my connections on all of this. And Dave adds, based on the Board of Park Commissioners meeting remarks, you can also walk or bicycle through the reverse parade, not just drive. So you have that option as well. Maybe this will be the model for, we might have a reverse Christmas parade, something like that, and you never know. Could be something to come. So I'm not seeing any other questions. Again, the plan here is that we will be back next Friday, and then we will be off the following Friday, but back, and I don't have the dates in front of me, but the following Friday in July. So we'll do
the 16th and the 30th.
Okay, 16th and the 30th. And so we will be back then and do our regular updates on that Friday at 1:15. Until then, we will see you next week.
Thank you all. Appreciate it.
Thank you all. Be well.